Hey folks, Dr. Joe Esposito here. I am so glad you're with us today. We're going to start out by talking about blood pressure. And this is the number one medication that I see patients taking. And I've been in practice now 37 years. So there's very few things I haven't seen. But the one thing I have seen is people take blood pressure medication a whole lot. And every patient that comes in that is on that medication eventually asks me the same question. They say, Dr. Joe, I want you to take me off my medication. How can we do that? And I tell them the same thing. I cannot take you off your medication. I am not your primary care doctor. I didn't prescribe the medication. I'm not going to take you off the medication. What I want to do is I want to get you well enough so that you don't need the medication. Catch a little semantics there? So if you get healthy enough, you won't need to take that medication anymore. So that's my goal. I'm going to give you a bunch of tips that you can do starting right now to help naturally lower your blood pressure, so hopefully you won't need the medication anymore. It's lifestyle decisions that you make every day that are going to be key to making this thing work. There's some easy changes you can make. Some of them might be a little more complicated, but if you just start with the easy ones and you start seeing progress, you're going to get excited and you're going to want to keep doing it. Now remember this, high blood pressure is not the problem. High blood pressure is a symptom of something that's causing you to have high blood pressure. Just like pain is not a problem. Pain is a symptom. What's causing the pain is what I want to find out. What's causing your high blood pressure is what I want to get to. So we're not treating the symptom, we're treating the cause. And that goes for just about everything I've ever done with my patients forever. Now, sometimes you do have to treat the symptoms. If you have high blood pressure and doctor says you need medication, well, probably a good idea to take your medication. Treating the symptoms until we can get to the cause. My job is to get to the cause. If I have a headache, if I have pain, I probably want to take some acetaminophen or I want to take some pain pills to knock out the pain, but then I want to find out why I have the pain. So we're always trying to get to the cause of the problem. So let's start out, not even nearly enough time to cover everything I want to talk about today. But you got to get a handle on your stress. When you're stressed out, your body makes hormones that cause your blood pressure to spike. So take note when you feel tense and then look at things you can do to calm down. Studies show that yoga and meditation can help lower blood pressure because you're relaxing. And we see this all the time. Patients come in, we take their blood pressure, and it's very high. Maybe they're in pain. Pain causes high blood pressure in some cases. So if you have high blood pressure and you're in pain, how about we treat the pain or the cause of the pain? And that may help the blood pressure. Follow that little thought process? Pretty cool, huh? And my doctors are really good at treating pain. My doctors are some of the best in the world as far as I'm concerned. So when patients come in and we take their blood pressure and it's high, a lot of times they'll say, well, Dr. Joe, I don't usually have high blood pressure. That's really strange, but I was really nervous coming in today. It's called white coat syndrome. Now, my doctors and I used to wear white coats. This is years ago, white lab coats and look like real doctors. And we realized that that could be a problem. Because animals would freak out if somebody brought their dog or their cat in just to say hi. We don't treat the animals, but they come in and say hi. Kids would freak out because they'd see the white coat. And many times adults would freak out because when they see the white coat, they immediately start to associate it with drugs or injections or some type of treatment or bad news. And so white coat syndrome can cause your blood pressure to go up. So now my doctors don't wear white coats anymore for that exact reason. And we even stopped wearing ties because we want to get as casual as possible to get people to relax when they're in our offices. There's three types of stresses we have to look at: chemical, physical, and emotional stress. Now, chemical stress, you have control over a lot. Chemical stress might be food, drugs, alcohol, environmental toxins. If you have a house that has mold in it, that could raise your blood pressure. If you have a house that uses a lot of air fresheners and cleaning products and bleaches, those chemicals can raise your blood pressure. So environmental issues you might have some control over, but not all. Food issues you probably have 100% control over. Now, doctors will tell you to cut out salt. Well, that's a smart move. Salt causes you to retain fluid. Fluid raises more fluid, higher pressure, raises your blood pressure. So it's not real rocket science to cut out salt. So just cut out salt. And it's not just the salt you add, it's also the salt that's in chips and processed foods and bagged goods and sodas, and soda even has salt in it. Isn't that weird? They put a little salt in there because when you put salt in something, it causes your salivary glands, your spit glands, to release saliva. Saliva has something in it called salivary amylase. Salivary amylase breaks down carbohydrates and makes things taste sweeter. So a little bit of salt in with your sweet things make it taste even sweeter still. So you can get salt in so many different places. Now, I was on a friend of mine's show, Eric von Hessler. I was on his show a while ago, and we were saying how sugar is a salt. He says, how could sugar be a salt? I said, a salt is anything that dissolves in fluids. It breaks up. And he said, but salt's a salt. Sugar's not a salt. And we had this little Abbott and Costello thing going on. But we're talking about table salt, okay, sodium chloride. So when salt gets into your body, it can raise your blood pressure. Cutting out the 7 deadly sins, if you're new to the show, I'll give them to you in a second. Cutting out the 7 deadly sins changes everything in your life. 7 deadly sins are the foods you want to avoid. Those are alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. Now, if you're new to the show, you just thought, Dr. Joe, that's my whole diet. I can't live without alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. And the answer is yes, you can. And I've been teaching that for 40 years now. I can teach you how to do it. It's not hard. Different, but it's not hard though. So eating more fruits, vegetables, nuts, and seeds are great. That's what your diet should consist of for so many different reasons, not just high blood pressure, cancer, diabetes, obesity, the high blood pressure, aging. Eating bad food speeds up the aging process. Why would you want to speed up the aging process? Why would you want to increase your risk of heart disease, diabetes, cancer, obesity, colon problems? Every time you eat bad food, you're increasing your risk of getting these diseases. Why would you want to do that? There's only one reason. And the only reason that you would want to eat bad food is it tastes good. That's it. Bad food tastes good. I remember the days when I used to eat bad food, and it tasted good. So if you're eating bad food, you just have to say, I don't want to do this anymore because I realize the consequences. I always asked myself when I was first transitioning to a healthier lifestyle, is it worth it? And you can ask yourself that in many, many aspects of your life. Is it worth it to go to work? Is it worth it to deal with the stress of a family or whoever family members? Is it worth to date somebody? Is it worth to be around somebody you don't like? And you weigh the pros and cons. Make a checklist. Okay, bad food, positive, tastes good. Negatives, increase your risk of diabetes, heart disease, cancer, makes you fat, shortens your life expectancy, is bad for the environment, is bad for you, can cause headaches, affects the brain function, affects the heart function, affects your colon function. The list of bad reasons, of cons to eat bad food is far greater than the good reasons. So, and don't give me that, well, it's cheaper. You can get cheap food. You can buy a can of beans for $1. And you can get a bag of rice for probably $1, and you can eat beans and rice at least 2 meals right there for $2. Now, oh my gosh, I have to cook the rice. That might take time. Yeah, it might. But by the time you get in your car, drive to the fast food place, get in the line, pay the person, unbag it, sit down, eat it, it's the same amount of time. And you're saving money, and you're saving gas, and you're saving the environment, and there's no downside to eating healthy. So anyway, back to where I was. Mental stress. Mental stress I probably can't handle for you. It might be a job, might be a relationship, might be family, might be your house, might be your toilet leaking. There's a lot of mental stresses that can occur. But if your body's healthy, you're able to deal with the mental stress a lot easier. So this is why we may all have the same stressor, whatever that is, but different people respond differently. A lot of it has to do with their diet. So the mental stress, if we fix the chemical and the physical, many times the mental stress gets lessened too, lowers your cortisol levels, which is a hormone that's released when you're stressed, and lowers your blood pressure. And then there's physical stress. Physical stress is pain. Now, I'm board certified in chiropractic. I'm also board certified in orthopedics. I'm also board certified in pain management. And I'm double board certified in nutrition. So my team of doctors, and we have offices in Marietta, Duluth, Stockbridge, and West Cobb, in the Atlanta area. My team of doctors are really good at dealing with pain. And I've trained them a lot of techniques. They've brought a lot of techniques to the table when they joined our team. And so we have 6 doctors working on your case at any time. So it's not just one doctor. And so instead of going to one doctor, getting a second opinion, get a third opinion, running around, paying all these fees, you get all the doctors giving you their opinions in one case. And then we sit down and we discuss what's going to be the best treatment for Joe or Barbara or Agnes, whoever. And sometimes we disagree. And then we sit down and say, let's be logical. What's going to be the best one for this? Almost always, I'd say 99.9% of the time, the doctors say, I never thought of it that way before. Thanks, Dr. Kat. That was brilliant. Thank you, Dr. Amy. I never looked at it from that angle before. Dr. Irwin, that's a real good point about fixing their foot because that can affect their knee, which can affect their back. Dr. John, you come in with a different college than the rest of us. You come in with a different perspective. What can we do with this? Oh gosh, that's brilliant. Thank you. So it's really neat when we have our team meetings with patients and the doctors all put in their input and the patients get excited. So if you're in pain, that could be the reason you have high blood pressure. Now, also the nervous system controls your high blood pressure. So if you have a pinched nerve going to your heart, it can affect blood pressure. If you have a pinched nerve going to your adrenal glands, it can affect blood pressure. The vagus nerve, which is a parasympathetic nerve, calms you down. If it's being irritated, it can affect your blood pressure. Digestive issues, heartburn, acid reflux, burping, gas, bloating can affect the vagus nerve, which affects the parasympathetic-sympathetic balance, which can affect your blood pressure. So if we can get the physical part fixed, and my team of doctors are really good at that, and then we teach you how to do the chemical part, which is really easy. Stay away from the bad foods and eat good foods. And then we talk about a supplement protocol. In many cases, we can naturally lower your blood pressure without having to take the medications. Now, don't stop the medication until you lower it. Now, supplement-wise, what I take to keep my body healthy is Dr. Joe's Super Greens and Dr. Joe's Essential Source. They're 2 powders. They taste great. And I can't imagine a day going by without taking Super Greens and Essential Source. I take a scoop of each. This morning, I didn't have any milk with me, so I had some water. I just shook it up in a little shake-up jar, and I drank it. It was wonderful. You can mix it with coconut milk, almond milk. You can mix it with a frozen banana, frozen mango. My new thing now is frozen mango. I'm on a frozen mango kick. So I was in New Jersey last weekend, and I found a place that had frozen mango smoothies. And it was just frozen mangoes. It was great. So I really enjoyed it. So it's my new kick. So you can put frozen fruit in there. You can drink it with water, drink it with milk, whatever you'd like. I can't imagine a day going by without Super Greens and Essential Source. The other magic supplement that seems to work very well for people with blood pressure issues, high blood pressure issues, is nitric oxide. Not nitrous, nitric. Nitric oxide is a vasodilator. It opens up your blood vessels. And as the vessels get wider, the pressure drops. And I've had countless patients over the years take the Super Greens Essential Source of nitric oxide and say, Dr. Joe, it's unbelievable. Within days, in some cases, not always, I started to see my blood pressure drop. So that's pretty cool. But that still doesn't always get to the cause of the problem. Then we got to find out, is it a pinched nerve? Is it a pain issue? Is it an emotional issue? Is it a chemical issue? We're always trying to find out where that blood pressure is coming from, and we can fix it. If the liver's clogged up, if you have fatty liver, maybe you're an alcoholic. Fatty liver, the blood flows through the liver. It's a filter. If the filter's clogged up, you can get back pressure. When I went to school, there was only alcoholic fatty liver. Now we have a new condition called non-alcoholic fatty liver. And that comes from eating usually too much sugar, specifically fructose. So if you're eating a sugar diet, breads, cookies, cakes, donuts, pastas, sugars, candies, sodas, the sugar can actually cause fat to form in the liver, which can clog up the liver, which can put back pressure, and that can cause issues as well. So you see, the easy fix is just take some blood pressure medication. But we never get to the cause of the problem. And if we don't get to the cause of the problem, it's going to cause other problems as well. So we always want to find out why. Is it chemical? Is it nutritional? Is it mental? Is it physical? We always want to dig deeper. And those are the things that work real well to help naturally lower blood pressure. Even adjusting your atlas, your top bone in your neck. Putting the top bone and neck back in place, there are many studies showing that it can affect blood pressure. So chiropractic care, fixing the stomach, fixing the digestive system, all this goes into play to get that blood pressure fixed. The problem is blood pressure medication has side effects. Read that little thing, that little piece of paper that comes in with your medicine. It's too small to read, like a mouse typed it. My friend Clark Howard calls it mice type. If it's mice type, you can't read it, get a magnifying glass, and you'll see a lot of issues, including erectile dysfunction and impotence. So gentlemen, if we can get you off those blood pressure medications, the whole world is going to be a happier place. And for women, you need circulation as well when it comes to romance. So it can affect many, many aspects of your life. Eating, of course, is going to be a key. There's something called the DASH diet, D-A-S-H. Now, DASH stands for Dietary Approaches to Stop Hypertension. Now, if you read the DASH diet, it tells you to eat a lot of fruits and vegetables and nuts and seeds, and they talk about grains and lean meat, which I don't agree with, and staying away from saturated fats and cholesterols. So it's basically what I've been teaching you for the past several decades. Avoid the alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. Eat more fruits, vegetables, nuts, and seeds. The only difference between what I teach and what the DASH diet teaches is they say you can have a little bit of animal protein, as long as it's lean animal protein. Why? Why would you eat that if that's not the best food for you? Why would you want to do anything that isn't the best you? And eating is the one thing we do all day, every day. I want you to make better choices when it comes to that. So it says start slowly, add a vegetable to each meal. And I understand you're dealing with a lot of people who aren't willing to change their diets. But just yesterday, as a matter of fact, I met with a neurosurgical team, and the best, as far as I'm concerned, certainly in the Southeast, maybe the world. And they came to me and they proposed, and we started kicking this idea around, where all their surgical patients come to me for a dietary workup. This is revolutionary in healthcare. Now, I've had a few here and there. Doctors send me patients. Yeah, take a look at this person. We can't operate on them yet. Get them to lose some weight, blah, 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 blah. But they want to do it across the board for all their surgical patients. How exciting is that? Where finally the medical world is saying, wait a minute, this is a really cool thing, and we can get better outcomes. And better outcomes, all surgical places are monitored for their outcomes. And if we get better outcomes, we'll make more money and we'll see more patients and we'll get better results and nobody loses. I said, yeah, now you got it. So that's pretty exciting. So anyway, the DASH diet's a good idea. It's not the best idea. The best idea is do the DASH diet, but cut out the animal products, and I think you'll be a whole lot better. So the nitric oxide we talked about is a great supplement to add. If you have low blood pressure, I don't recommend you take nitric oxide because it can make the blood pressure even lower. Now, if you take nitric oxide, super greens, essential source, change your diet, get chiropractic care, monitor your blood pressure. Because if the blood pressure goes too low, we have to cut out either the nitric oxide, the super greens, the essential source, chiropractic care, or the medication. I think I know which one you're going to choose. So I'm not telling you cut out the medication. I'm telling you let's get you well enough so you don't need the medication. We talked about cutting back on your salt. Absolute no-brainer, folks. Salt is so bad for so many different reasons. If you're going to use salt, it's got to be air-dried sea salt, pink salt, Himalayan salt, Celtic sea salt. Those salts, a little bit okay. You really want to cut back on the salts, though. And, sodium. Look at the sodium content of food. And soups especially are notorious for having huge amounts of salt in them because they taste good. Salt makes things taste good. I'm not going to lie. I mean, I like salt too. But make sure you're eating the right salt and cutting it out the best you possibly can. So we talked about the hiatal hernia, the digestive issues, acid reflux, heartburn, burping, gas, bloating. That can be an issue. Now, years ago, it's affecting the enteric nervous system, which affects the vagus nerve. The vagus nerve controls the blood pressure. So, wow, tracing it back. Isn't that cool? Tracing things back to figure out where they're coming from. You got to cut out not only the salt, but the sugar. High amounts of sugar can raise your blood pressure as well as inflame your body. Don't be surprised to find sweeteners in things like soda, cereals, cookies, but they also hide in salad dressings, in soups. So we said sugar is a salt because it dissolves in fluids. So yes, sugar is a salt. So cut out the sugars as well. And you don't want to have, a medical guide is you don't want to have any more than 36 grams of sugar a day. 25 grams is really too much. And that's about 36 grams, about 1 can of soda. So if you drink 1 can of soda, you can have absolutely no more sugar for the rest of the day. Or if you have to have soda, there's soda sweetened with stevia. One brand is called Zevia. I think Blue Mountain might have some with Lohan or monk fruit or something like that. So don't use artificial sweeteners. The worst of all the 7 deadly sins is the artificial sweetener. So don't use that. Don't use the sugar either. If you have to have soda, there are alternatives. Sweetened with stevia, monk fruit, xylitol. Those are better choices. You want to cut back on your caffeine if you have high blood pressure. This blows my mind when I see people on blood pressure medication drinking coffee every day. That's taking a fire, putting water on it, then putting gasoline on it, then it blows up again, then you put more water on it, then you put gasoline on it. Folks got to cut out that caffeine. If you need energy, A, change your diet. B, what I do for energy, supplement-wise, of course, super greens an essential source, minimum supplements I think everybody should be taking. Nitric oxide will give you a ton of energy. In fact, just yesterday, I took a nitric oxide, and I took it a little later in the afternoon than I usually do. I took it at 2 o'clock. I usually take it at 12. And I was buzzing. Laying in bed last night, I was just looking around, and I was so happy. And it's not a caffeine high. It's just a good high, energy-wise. B-complex will give you energy. Dr. Joe's adrenal support, nitric oxide, super greens, and essential source. If you take those supplements, A, it's going to help your body, and B, chances are you won't need your coffee anymore. And C, as a bonus, you'll probably save money because it's cheaper to take the supplements than it is to buy those fancy coffee drinks. And so you'll save money, feel better, live longer, have better energy, sleep better, lower blood pressure, better love life, better brain function. I'm not getting a downside to this, folks. I'm really trying to find a downside to being healthy, and I can't find one. So cut out your coffee, especially at night. Coffee has a half-life of 12 hours. What that means is half the caffeine will be out of your system in 12 hours. That means the other half is still there. So I can't do any type of stimulant, like I said, closer to bed. I just go nuts. Maintaining a healthy weight. If you don't know how to maintain your weight, go to our website, drjoe.com, and type in the words weight loss. And we did a really good show on weight loss. We also have a program. It's a 21-day jumpstart. Because you got to jumpstart your body to reset your brain. Your brain is why you eat too much, okay? So it's a hypothalamus, a part of the brain that controls hunger. And if the hypothalamus isn't getting messages from leptin and a hormone from the stomach called leptin, a hormone from a small intestine called ghrelin, you can't stop eating. I've been there. I used to be fat, so I know exactly what you're going through. So we get you on a 21-day jumpstart program, which is it's food. I mean, you're not starving, but it's supplements and shakes and also regular food as well. And then it gives you a chance to reset the brain. And then we go into phase 2, which is just eating right forever. So that's a good thing. So if you want to know more about that, if you go to our website, drjoe.com, you could look that up. And you'll find some good information about it's called the 21-day detox or 21-day cleanse. And listen to the show we did on weight loss. And because I used to be overweight, I totally understand what you're going through. So if we can get the nervous system working, the digestive system working, the diet straightened out, quality supplements, chances are very, very, very high that you'll be able to bring down that blood pressure naturally. So pain is the big issue. So if you do have pain, if you have neck pain, back pain, shoulder pain, numbness, tingling, sciatica, carpal tunnel syndrome, shoulder issues, headaches, come see us. Stop suffering needlessly. Patients come in every day. We have 4 offices, Marietta, Duluth, Stockbridge, and West Cobb, and Atlanta. And they say, why didn't I do this sooner, Dr. Joe? Why didn't I come see you sooner? Because I've been suffering for so many years. I've spent so much money. I've taken so many medications. Sometimes you need that, but in most cases you don't. And we fix them up, and they're thrilled, and they send their family. And that's why it's sometimes hard to get an appointment with us because we book up pretty quickly. So if you want to make an appointment, go to our website, drjoe.com, drjoe.com. The initial visit is normally over $500. We've reduced that to $249. We are going to change that in the next week or two. I've been promising I'm going to do that, but we're still figuring out the numbers. But $249, exam, x-rays, consultation, first adjustment. On the second visit, going over the x-rays and a complete nutritional evaluation. So if you want to do that, you can do it right now, drjoe.com. Just click on the office. That's on the website, the map, and you can book it right online. You can call us through the website too, and we'll get that set up. We accept insurances. We file your insurances for you. Almost all insurances we accept. Car accidents, folks, if you've ever been in a car accident, ever, if the car was damaged, you were damaged 100% of the time. That's my experience. I've seen thousands and maybe tens of thousands of car accidents. Make the appointment as quickly as you can. drjoe.com. You can book it right online or call us. We even accept Medicare. So we will do a nutrition evaluation, check the digestive system, see if the vagus nerve and the enteric nervous system is being involved and how hopefully we can fix it. We then look at your diet. We put together a nutrition protocol for every one of our patients. And if we can get those 3 things working, nervous system, digestive system, and diet, not only will blood pressure hopefully get better, your whole body will get better. Your whole life will get better. The extent of your life will be longer, we're hoping. So there's no reason not to do it. As far as the supplements we talked about, Super Green, Essential Source, Nitric Oxide, B Complex, Adrenal Support, and many others, they're all on the website, drjoe.com. If you have a question, send it through the website, drjoe.com, and me or Joe will answer it. And I need you to do me a favor. I need you to follow us on social media, Facebook, Instagram, YouTube, and Twitter, at Dr. Joe Esposito, at Dr. Joe Esposito. Folks, I'm Dr. Joe Esposito, the website, drjoe.com.